Hi, my name is Anika Srinath and I'm from Austin, Texas. I've lived there for my entire life, and before attending UT Southwestern Medical Center, I graduated with a BSA in biochemistry from UT Austin. While in college, I was a teaching assistant for biostatistics, so I have had experience with teaching and tutoring in an academic setting. And prior to that, I was also a piano teacher for several school children in my neighborhood. This passion for teaching and being involved in teaching settings originated from my time in high school when I was actually a camp counselor for a Taekwondo camp, and I would teach Taekwondo classes, and I would also help the students attending these Taekwondo summer camps with their homework, and that's when I really started to develop that passion for teaching and mentoring. In terms of my specialty and plans for the future, as of right now, I am interested in pursuing a career in obstetrics and gynecology. I am an officer of our Global Health Interest Group. Global health is something that I'm very passionate about, and I think that when we consider the future of medicine here in the United States, it's very important to learn a little bit more about how other countries tackle their health disparities and try to prioritize providing medical care to as many people as possible. I also am part of the free clinic system here at UT Southwestern, so we have a lot of different student-run free clinics that cater to the uninsured population here, and I'm a manager at one clinic called the Monday Clinic that is in partnership with North Dallas Shared Ministries, and I volunteer at this clinic every week helping with intake. And then the student-run free clinic mainly caters towards medical student education and having medical students come in and do history and physical exams on the patient attending the clinic. In addition to that, I am an officer of our Conversational Spanish and Medicine organization at my school, which is aimed towards teaching my peers Spanish, because here in Texas, it's very vital that you at least have a basic sense of Spanish to be able to better connect with the patients that you'll see. And I'm also helping organize a session to help teach medical students basic Spanish phrases prior to going on their clinical rotations, so that whenever they encounter Spanish-speaking patients at the hospital, they feel a little more confident in having some basic social introductory interactions. I am a Hoffman Scholar, which means that I received a scholarship to fully cover my master's in public health, and I am currently pursuing a dual MD and PhD degree right now. I'm very passionate about public health and think it's very important. And then I also received the Dallas Women's Club Scholarship, which contributed towards my medical school tuition. In considering the key to success on the MCAT, I believe the most important thing you need for the MCAT is resilience and practice. The MCAT is really a test of strength and whether you are able to sit there for 7 hours and power through all of the questions you are going to be presented. And I think if you have the resilience to get through all of the content and to hammer in as many practice questions as you can, that will really define the score that you ultimately see on test day. I really like to focus on practice questions and how students can use the phrasing of the questions, the answer choices, and the passage itself to get towards the right answer. I believe that a big part of the MCAT is pattern recognition, getting used to how they answer the questions, and based on the question being asked, what are the type of answers they want you to choose, and how can you get to that answer using the passage in front of you. At the end of the day, the MCAT covers a lot of content, and you might not remember every detail, so I really like to focus on how we can maximize what you have right in front of you to make sure that you ultimately get to the right answer. I would say my greatest strengths are that I am very patient, I am relatable, and I have a Google Calendar where I meticulously write down exactly how I studied to the minute, and I have a very good idea of how to schedule my time to make sure to meet my goals. And I think that organization and that reliability on my end will allow me to provide the best schedule for you as my student in order to meet all of your study goals. And I think even if you feel like the content is overwhelming or you don't know how to structure your time, I think organizing time and finding structure and a realistic schedule is a strength of mine that I could help impart to you to make sure that you'll find success. I personally do not have any family in medicine, and I know that this application process can be very scary and very overwhelming. It's honestly very confusing, and it can be really hard to find transparency on everything that you need to get taken care of in the process of applying to medical school. And I think for our patients, we're all here to help. We're all passionate about medicine and being there for other people. And so I think it's really important that we support each other in this career, because it can be very grueling and very isolating. And honestly, it can be really hard to push through it. And so I'm very passionate about being there and supporting my peers through this career as much as I possibly can, so that we can one day all be physicians who just get to be there for our patients to the best of our abilities.